Hello, this is John, and this is Chapter 2, Workforce Safety and Wellness of the EMT. So first I want to talk about the process of death and dying. I know it's not a popular subject, but as EMTs, you're going to interact with patients going through the dying process, and you're going to be interacting with family members and survivors of people who have died. And it's really, really important that we're able to handle this and deal with this in a mature way so that we can support the person going through the dying process if that's what they need. And we definitely want to be there to support the family, the friends, the bystanders, the survivors. So there was a study done many years ago, and the thesis basically said that everyone who goes, including the survivors, everyone who goes through the dying process goes through these 5 stages, the 5 stages of death and dying. And so in the very first one, denial, this should be pretty obvious. Humans have a tendency to be in denial about everything. So imagine if you went to the doctors and the doctor said, you have cancer, you're going to die in 6 months. I would imagine at first you'd be kind of like, I don't think so. Kind of makes sense. Once this kind of, at some point sinks in, you become angry. Now, of course, anger can be an issue for us as EMTs. Most of these patients that are terminal, the ones that I've encountered that are angry, it's always verbal. They express it by yelling at you, calling you names, things like that. I've never encountered one in my years of working that was physically trying to harm us, but there is that potential. So if you go to someone's house and you have a patient who's terminal, they've got a few months to live, and they're calling you names and they're swearing at you and they're just being really angry people, don't take it personally. It's purely a case of they're angry at everyone, themselves included, and they're taking it out on everyone around them. So the only way you can do this is just be really kind, keep a calm voice. I'm really sorry you're feeling so poorly today. My partner and I are going to take you to the hospital. I'll tell the doctor immediately that you're in such pain, and they'll get you some medications. Is that okay? Just, be nice to them, even though they might sound like they're not very nice to you. At some point, everyone tries the bargaining thing. Hey, great deity in the sky, if I stop doing drugs and having wild sex parties, take away this cancerous tumor. It doesn't work, or who knows? I guess it doesn't work. And then it finally all sinks in. They go, oh, yeah, I'm going to die. And now they go through the depression phase. And this is another phase when we might encounter them because quite a few of these people try and take their own lives. Most of the people going through this dying process, they've been diagnosed with terminal disease. They're probably in what's called hospice care, or palliative care is another term for it. And they're given all types of pain relievers and antidepressants and sleeping pills. And you can see the potential here. They take too many pills, whether it's on purpose or by mistake, who knows? But they're trying to speed things up a little bit. So it does happen sometimes. And then finally, with all this, at some point they do accept the process. They're not happy about it, obviously, but they go, yes, I am dying. I just want to get this over with. Now your focus would be towards the survivors, because the patient's already gone through these 5 stages and they're already ready to pass on. The family, and the family's probably not ready to accept this just yet. And again, your job now is to be with them, talk with them, explain things to them, and keep them kind of grounded so they can get through this as well. So really, really important things that I've seen out in the field that should never happen is you'll go out to a call, you'll go to a private residence, you have a gentleman in bed like you see here in the picture. The family's there, the gentleman has a few months to live. He's slightly disoriented. He can talk to you, but he's pretty confused. And what I'll see a lot of times, first responders, paramedics, EMTs, they talk over this person. They'll talk to the family, they'll talk to the survivors, and they totally ignore this person. So it's really important, even if the person is disoriented, mildly confused, include them in the process. At least let them and the family know that you're aware that they're a person and they should be included. Be respectful at all times. Be careful with these people. They're rather frail. If you are lifting or moving them, just really be careful about that. Make sure they're warm. Make sure they're not injured by the move and things like that. And communicate really, really well with everyone. It's really important to explain what you're doing, why you're doing it, what's going to happen, where you're going to go. Make sure that they have a way of getting there where you're going with the patient, or at least the information, the address, things like that. So communicate clearly with the survivors, with the family members. I never lie to anyone. This does happen sometimes. I've seen this happen a few times on pediatric CPRs, like a SIDS baby CPR or a drowning child. And the first responders will get there, and because they really don't want to talk to the family, because talking to the family is kind of scary, and they'll say, oh, he's fine, and they'll just grab the kid and they'll drive off. But realistically, the child's dead. So that's not good, because it does give them false hope. And they're thinking, oh, little Johnny's going to make it, and they drive to the hospital and they find out the kid's been dead for hours. So really bad things. Be honest. If you think this person is not going to make it based on your clinical findings, sit the family down and talk to them, explain what you believe is going on. And it does really help a lot with closure. And if you are at scene with family or friends or survivors, it's if you can get them involved in the process in some non-invasive ways, so to speak, it really helps with them once this patient does die. Helps them with closure, to get through this dying process and come out a lot healthier, at least emotionally anyway. So some scenarios here. So the number one scenario here, you have a 4-year-old female found in cardiac arrest in her bedroom by her family. So you arrive on scene, the child has no pulse, they're not breathing. You start your compressions and ventilations, and of course you attach the AED. You're going through your cardiac arrest protocol, and the family's there. The mother and father are there. They want to observe what you're doing. They want to come into the bedroom and observe what you're doing. If they're emotionally able to handle the situation, if they can stand there and watch, definitely I want them in that room. 2 reasons. One, if the child survives and they're in the room with you as you're going through your protocol, they're going to feel like they were part of the survival process, and they're going to feel better about what's going on. On the other hand, if the child is found to be non-viable and not recover, they've seen everything that you've done to try to save their child, and they feel like everything it was done, and they're satisfied with that situation. And again, they feel more comfortable accepting the fact this child's no longer with them. Now, of course, if they're completely distraught, if they're so freaked out that they're interfering with your patient care, then no, they would not or should not be allowed in that room. Number 2, 82-year-old male found unresponsive by his wife. Patient's lying in bed. You get there, no pulse, no breathing. We really don't know how long this person has been without a pulse, but we start our CPR, we get the AED attached, and we go through the process. And you go through your rounds of CPR and your AED prompts and all that, and they're just not responding to your care. So now you're thinking this person's been down for a really long time, without a pulse anyway, and even though you're going to continue your CPR, you're going to now focus now on the wife, the survivor. So you're going to sit her down and you're going to explain what you've done, what's going on, and what your clinical, findings are. And you're going to ask her options. You're going to ask her, what would you like us to do? Here are your options. Would you like us to continue CPR and transport your husband to the hospital for final verification by a physician? Or are you comfortable accepting the fact that he's not going to recover or survive, and we can just stop the process with the assistance of the doctor over the radio? So just ask them, again, get them involved in that process. Number 3, so you have a 25-year-old male at the trolley station. His patient's in cardiac arrest. There's a needle in his arm, so he OD'd on something fun, as you can imagine. The highest priority, of course, is you're going to start your compressions and ventilations and attach the AED. But because they're in a public place, our second highest priority is to move them out of view into the back of our ambulance. So you started compressions and ventilations, you attach the AED, you get the spine board as soon as you can, get them on the spine board, get them on the gurney, get in the back of the ambulance. It's a lot better to move them out of these situations in these public areas. Whether it's Petco Park or whether it's Walmart or Starbucks or a restaurant, usually you'd want to get them out of those areas, especially in the retail businesses like Starbucks, like Walmart, like Albertsons. Management is going to want you to move this person quickly because it's interfering with their business, and they will actually come up and tell you that. So why not just move them quickly? Be a lot easier to do it in the back of the ambulance in private, and then you can go through whatever you need to do at that point. So you guys should already know what stress is. We all go through stress every day. Driving your car in heavy traffic, going to work, going to school, paying bills, paying rent, taxes, interpersonal relationships. They can all lead to various types of what are called societal stressors. If you work in the medical field, especially in pre-hospital medicine, like you will as an EMT, there's a lot of other stressors you will encounter on top of that. So you have these normal societal stressors, and then you also have these job-related stressors. And if you're either not prepared or you're just not that person that has that personality, these can compound, and you can be physically and also psychologically affected by this extra stress that you're being subjected to. So physiologically, what we have in our body is we have a system called a fight and flight response. So we have an organ called the adrenal glands, and when we either consciously or subconsciously perceive a threat or a risk, our body releases adrenaline. And what the adrenaline does physically is it increases our heart rate, it dilates our pupils, it opens up our lungs so we can get more air into our lungs. It makes our muscles stronger. So literally, this is a case of you are being threatened in some way, and you're either going to fight or you're going to run away. And this is something everyone has. Everyone's felt it. Maybe you went to a job interview and you were really nervous, and your palms were sweaty, and your mouth was dry, and your stomach was butterflies, and your heart's pounding in your chest. Those are all symptoms of the fight and flight response. But once you get out of this perceived threat, like the interview, and you start to calm down, your heart rate drops and all that, and it goes away. Until the next time, of course. The problem with all this is if you have this constant stressful situation at work, and then you have all the other stressors at home and all that, what happens sometimes is the adrenal glands just keep pumping adrenaline, not just for a few minutes, not just for a few hours, but day after day after day. And what happens is it does cause your body to become physically stressed, and it can cause your immune system to become compromised. And then that makes you more prone to disease, cancer, other things like that. So physically, over the long haul, it can lead to all kinds of physical ailments, just because of this overstress situation that you're in. Psychologically, also, because you're not feeling well and because you're just feeling anxious, and you constantly have a little tremor going on, your heart's always pounding, and you don't know why this is going on. You're like, wow, this is really, really weird. And you start thinking, well, gee, I don't really want to go to work, but I got to go to work because if I don't go to work, I don't pay my rent. And now you're depressed and you're anxious about going to work because if you go to work, you might do something wrong or hurt somebody. And you can see it kind of spirals. On top of all this, if you have friends, family, loved ones, you can wind up being alienated from them because of the depression and because of the anxiety as well. So these extra stressors can lead to all of these. You can see the list right here with this gentleman on the screen, that can lead to all kinds of problems and obviously, emotional breakdown. So these are just some of the high stress situations. You can just read through them. Again, it really comes down to your personality. Some people are just born to or can do this without any kinds of problems, and some people respond very poorly to the situations in EMS. It really depends on just how you're wired, I guess, emotionally and mentally. So various types of stressor reactions. So the one that we see the most in EMS is the one at the bottom. So this basically is just burnout. And this is the person who has that drip, drip, drip of adrenaline going on. They just, they're always tense. They're always nervous. They're getting depressed. They're having issues at home. And burnout takes, I've seen people burn out in a year. I've seen people burn out in 5 years. It really depends on the individual, but they need a timeout pretty much. And it's really important for us to recognize burnout, especially in our coworkers, because burnout is unfortunately contagious. If someone's really stressed out and they're behaving abnormally at work, they're yelling at patients, they're yelling at their partners, they won't talk to anybody, they're always complaining. This, unfortunately, if you have to work with this person all day, 24 hours a day on a fire truck or an ambulance, you can see where you could wind up getting burnout as well. So it's really important that you recognize your partner's angry and they're dissatisfied with their job and all those things we talked about. The best thing to do, and this might sound like a cop-out, but it's really the best thing to do, is go to your supervisor and say, hey, I'm really concerned about John. He's acting this way. Would you mind talking to him? You yourself should not confront them, because if you do say, hey, John, I'm really concerned about you, I think you might have burnout, they'll take that as kind of some kind of challenge or some kind of issue like that. So they might get angry with you and make the situation worse. Whereas if you have a supervisor talk to them, it can get help. Well, they can get help much easier, obviously, and it won't include you in the process. The other one that's really commonly heard of is PTSD. And this is this delayed stress reaction. Something happened to you years ago, and then a year or 2 or 3 later, you start having these same kind of symptoms we talked about, the heightened pulse and the feeling tense and nervous and not being able to concentrate and things like that. We don't see too much of this in EMS or fire. And you don't have to be military and go through, a military situation to have PTSD. People who have been raped, people who have been shot at or have been shot by guns or blown up, or they've been in really critical traffic accidents and they almost died. All these people can go through PTSD as well. But again, not too much seen in EMS. The top one, this acute stress reaction. Very rare, but again, it depends on your personality. This is a situation where you see something or you're involved in something that day, something really that's emotionally, harming, I guess, for you. And then a few hours later, you start to react to it. So it's right after the event. I only know of one case of this, and it was when I was working as a firefighter. My captain, he told me of a situation that he went through with a dead infant. And he said that about after, maybe 3 or 4 hours, 5 hours after he dealt with this child, it just hit him. He started throwing up, he started shaking, he started crying. And again, it's kind of the same day kind of event. Very rare, but it does happen. Managing stress, all this stuff seems to be, pretty self-explanatory. People do yoga and they do Tai Chi and all that great stuff. Unfortunately, because if you are stressed out and you're going through burnout, your adrenal glands are pumping quite a bit of adrenaline, and people want to kind of tamp down that feeling of anxiety, of nervousness. So they'll drink alcohol, they'll take drugs to calm themselves down, which is really the wrong thing to do. And unfortunately, caffeine just makes the whole thing worse. So just keep that in mind. So really what it comes down to stress management is don't take your work home with you. Simple as that. You should, if I don't care whether you work as a doctor, a nurse, whatever you're going to do, EMT, paramedic, firefighter, whatever it might be, you need to compartmentalize what you do. Your work is your work and your home life is your home life, and the two should never overlap. So, and make sure that, if you do work as a firefighter, EMT, paramedic, whatever, doctor, nurse, PA, whatever it might be, just realize it's just a job. It's a great job, but it's just a job. It's not your entire life. So make sure that you have balance. You're taking classes, you're learning things, you're going on trips, something that separates you away from the stress of your work. And ultimately, if for some reason your work environment's really making you stressed, go to your company, go to your supervisor and say, hey, I'm having a bad time right now. Do you think we could move me somewhere else, a slower station or less responsibilities or whatever it might be? Ultimately, if you really are having problems, seek some kind of help. And if you can go to your company or your department and say, I'm having these problems, I'd like to have some time off, and I'd like to have access to some type of, counseling. And by state law, they have to provide you with that. It's required. They'll give you a month off, and they'll give you like 10 sessions with a counselor and see how things work out with that. If you are on a critical incident, like a dead child or a multi-patient incident or multiple shootings, things like that, that is high, what we would consider high stress calls, your agency might have you participate in one or both of these sessions. The first one is called a defusing session. And this is usually on the same day as the event. So you go on a traffic accident at 9 o'clock in the morning. There's 15 people. There's 5 kids. You guys get the idea. It's a stressful call. And because of the complexity and the stress of the call, they get, after everything's done, a few hours later, they get all the crews together into a room and they talk about what happened. And basically, this is just your way of kind of reviewing what occurred, and what could have gone better, what could have gone worse, things like that. It's called a diffusing session. And again, it's usually on the very same day of the event, and you'll be there with a captain or a chief, or there might be a counselor there as well. If you don't feel that's enough, or your agency doesn't feel like that's enough, they can you ask you to come to an official critical incident stress debriefing session. This is done a day to 3 days after the event. It's more formal. There will be some type of counselor there. There will be your supervisor, your chief, something like that. And again, now we're talking about, how are you dealing with this? Are you not sleeping? Are you not eating? Are you having nightmares about what happened? And they help you through this. Personal injury, my favorite picture of all times. So these are all the diseases caused by pathogens, amongst many, many, many more. Some of these are bloodborne, some airborne, some, through needle sticks, obviously. So it's really, really, really important that we use what's called standard precautions to protect ourselves from disease process. So hand washing is the number one reason or way we protect ourselves. And I know it sounds kind of weird because, wait a minute, I had gloves on the entire call. Well, the gloves that you're wearing, even though they're sort of watertight, they're not, they actually are porous, and really tiny microbes, really tiny pathogens can actually get through them. So when you're done with your call, you've turned your patient over to the doctor or the nurse, whatever it might be. You're going to go over to the nearest sink. There's tons of them in the hospitals. You're going to peel off your gloves inside out. You're going to wash your hands at least 15 seconds. You can, if you want, you can sing happy birthday. I probably wouldn't do it out loud though, because you might get yelled at. And then just scrub really, really well. Dry your hands really, really well. And after that, then you might touch your face or, whatever you want to do at that point. So make sure that's done before you touch anything that, might transmit those pathogens. When it comes to putting on gloves, when you're putting on your BSI, if you're working on a fire engine or a fire truck or a rescue vehicle or lifeguard vehicle, you get dispatched to an emergency, you should have your gloves on before you arrive at the scene, because you never know what you're going to encounter. And well, imagine if you're that person in the ambulance and you have not put your gloves on yet, and you arrive at scene and someone walks up and hands you a dead baby. You really think you're going to stop, lay the kid down on the ground, put some gloves on, and then continue? No, you're going to get caught up in the moment. You're going to forget you have no gloves on, and there's a problem. So put your safety glasses on, put your gloves on, have everything ready to go prior to you getting to scene. That way, whatever happens, you're prepared for it. Also, on top of this, we do go on multi-patient incidents. So we might have 3, 4, 5, 6, 7 patients in various stages of injury, and we might get our gloves contaminated with the blood of one patient. We definitely don't want to touch the next patient with those same pair of gloves. So rather than taking your dirty gloves off, you would put a second pair of gloves over your dirty gloves, and then you just keep changing gloves for every patient that you go to. And that way, the original gloves, even though they're dirty and they have blood on them, they stay on your hands, because if you try to take your gloves off, your hands are so sweaty, you're not going to get gloves back on again anytime soon. So all different kinds of PPE, personal protective equipment. For me, I worked for 30 years as a medic, and every single call I ever went on, I had my gloves and my safety glasses on. I highly recommend safety glasses. They're inexpensive. You can buy a nice pair for $10. Probably buy even cheaper, less than that. And I got to tell you right now, you can get blood in your eye, fluids, amniotic fluid, urine, feces, vomitus, and you don't want that kind of stuff happening. Now, obviously, we have gowns, all this through COVID and all that. We have masks and gowns and booties and all that great stuff as well. So you're gonna basically suit up whatever you need depending on the circumstances. But at bare minimum, my recommendation is just a good pair of protective eyewear that fits well. They do actually have ones that are prescription if you need prescription, and just your gloves on. And then the rest of it, the mask, the gown, the booties and all that can basically go depending on the circumstances. You already know about the immunizations that are required. If you do work in EMS or pretty much in any medical field, there are some basic required shots you do need. COVID now, of course, is optional, but the rest of these are pretty much required here, at least in the county of San Diego. You need to be updated on all of these. It protects you from these pathogens. And if you get something like, for instance, if you catch, let's say, the flu, and you're working, and you pass it on to your patients, and they get sick, that's really not really all that ethical in that respect. So it's good to protect yourself from these pathogens, so you can't pass them on to other people, your family members, people that are compromised with their immunities compromised, things like that. If you do get exposed to something, there's two types of exposures. The one we're really concerned about is a true exposure. So let's say you have like you see in the picture here, that needle right there, it has blood in the needle. You get stuck with that needle. That's a true exposure. If you get blood on your skin, and your skin, it has scabs on it, it has abrasions, the skin's not intact, that again is a true exposure. If you're with a patient who has tuberculosis and they're coughing up blood and they're actively having tuberculosis, and you're not wearing a mask and they're not wearing a mask, and you're in an enclosed space, this should actually never happen on duty, but you're in an enclosed space, I would consider that a true exposure as well. If you get blood if blood and vomit, urine, feces gets on your intact skin, that's really not a true exposure. What it really comes down to is report as soon as possible, on the very same day that it occurs. Make sure you fill out a form, make sure your supervisor knows about it, and they'll tell you what to do, where to go, and how to be assessed for it. So you'll know these little vests right here, I call them lawnmower vests or gardener vests. But there's 3 classifications of this, and for EMS and fire, we either use class 2 or class 3, and this is all about how much reflectivity that the vest has. So per federal law, if you're on a call, any call that's on a federally funded roadway, you have to wear some type of reflective vests, type 2 or type 3. Class 2 is the most common. What you see there in the picture, that's a class 2 vest. And then again, apparently, and I've never ever heard of it happening before, but apparently you can be fined if you're not wearing your vest. Lastly, with this is we do interact with situations, scenes that are unsafe to some extent. I know you learned about scene safety, but remember, scene safety is a dynamic, ongoing process, and it changes from second to second, literally. 1 minute the scene is safe, the next minute someone's trying to attack you, someone's screaming at you. So just realize that if the scene does become unsafe and you feel that you shouldn't be there, you have every right to back out and get away and call for police or sheriffs or whatever it might be. But it is out there. People have guns, knives, whatever it might be. Just be really, really careful. And I think we're done.